This is Jeff Strickland in MOT 136, Introduction to Clinical Skills, and I'm performing procedure 30-12, applying sterile adhesive skin closure strips. We've already set sterile supplies on a sterile field. So we have a Teflon coated gauze, Steri-Strips, forceps, scissors, and sponge forceps, and then some gauze sponges. Off to the side, out of sight, we have triple antibiotic ointment, gauze wrap, some more gauze sponges, paper tape, sterile gloves and non-sterile gloves, and betadine swabs in a dish. And also we have a roll of Copan. We've already seen the supplies and equipment set up on the sterile field. We have washed our hands and followed standard procedures or precautions. I've introduced myself to Rupert, my patient, and I've identified that he really is Rupert. He gave me his last name, first name, middle initial, and date of birth. So I've confirmed the procedure we are performing with Rupert and explained the procedure to him. And the Steri-Strips are already on the sterile field from earlier. So I've donned sterile gloves, and I'm going to clean the wound. This is benzalkonium chloride. And betadine. We'll allow that to dry. Then we're going to apply benzonium up the edges of the wound. Allow that to dry. Then we'll start applying our Steri-Strips. Put the center one first, and with a slight bit of tension. Again, just a bit, slight bit of tension in order to close the wound. I'm putting some antibiotic ointment on the wound. Then putting on a Teflon gauze pad. Take my gauze bandage material. And I'm going to wrap that. Asking Rupert to lift his arm for me. Then we'll cut that. Some paper tape. Let's put on there. And then just to make it, the dressing or the bandages more secure, we'll put on some Coban. And we don't want this to be tight either, so we just roll this out a little bit to give it some slack. And then we'll cut that. Then we'll give Rupert some home care instructions and go over them with him for post-wound care. And then document the appearance of the wound and the use of skin closure strips in Rupert's patient record.